The idea for the St. Vincent de Paul Charitable Pharmacy didn't start in an office on Bank Street. It started in the homes of the people we serve. Our volunteers went to visit, and they found that they were seeing people who had no way to get medication that they needed, and that was impacting everything else about their lives. So they brought that idea, and we thought, maybe this could happen here, but it is such a big project, and we are so small. That's when Leadership Cincinnati became involved, and their leaders were able to help us change state law in Ohio so that physicians could donate samples. They helped us set up the charitable pharmacy.
It was almost like a godsend. Liz Carter called me about the fact that they were going to open a charitable pharmacy, and I was contemplating retirement, and I wanted to stay in underserved care. We opened the charitable pharmacy in September of 2006. It was myself, volunteers, and a patient advocate. We were open for 2 days. The other 3 days, I went out and collected samples, and then I brought them back, and I had to manage our inventory. In 2008, we brought in pharmacy students. I precepted advanced practice students, and they came in, they helped me with filling prescriptions, but also we identified drug regimens that needed some work. In some cases, we didn't have exactly what a patient would need. So the students helped me with that whole process, and they got an education as well. Medication access is only the start. It's important. It's what we did with the charitable pharmacy, and we have metrics to show that our patients were helping to save lives, and they're getting positive health outcomes.
In my first week as a volunteer at St. Vincent de Paul Charitable Pharmacy, I was sweeping floors, stocking shelves, just doing whatever work the pharmacist needed help with. And that's the first time I heard someone say the words, "You saved my life." And that lit a fire in my soul. I knew what I was going to do for the rest of my life. And so from then on, I wrote grants. We created clinical pharmacy programs to prove health outcomes, to prove that giving out free medicine helps people in need. The charitable pharmacy innovates to meet the needs of our neighbors. When our neighbors said we don't have transportation to the pharmacy, we started a rideshare service to help close transportation gaps. During the pandemic, our neighbors said we don't have access to primary care, and that's when we brought a nurse practitioner into our staff to start a free clinic. We've been able to receive medication donations from drug manufacturers, from long-term care pharmacies, but we couldn't receive medications from individuals in the public. We said we need to do something about this. We wrote a bill that became law that allows the general public to come in and donate their personal medications.
We really rallied. We testified at the House and at the Senate, had a unanimous approval. And since that law change happened, we have yet to purchase insulin because the donations have sustained us. The charitable pharmacy matters. It's a life or death situation for most of our patients. We serve thousands of patients, and it's hard for me to even think about, without getting emotional, what would happen to them if we weren't here. Patients like Eric and tons of others that have already experienced what happens without their medicine. Eric came to us a heart transplant patient.
I had congestive heart failure, and I was treated for that for 3 years. Before I knew it, I was in a new hospital room. The next thing I remember is the next day I opened my eyes. And I'm like, wow, I guess I'm going to live. I'm diabetic. I was spending close to maybe $300 a month on medicine. And I remember going and sitting down in one of the conference rooms here, dumping them all on the table. And they looked at them, we have this, we have this, we have this. They had everything. It's hard to believe where I might be without St. Vincent de Paul. I mean, might not be here talking to you today, but I'm here. I get insulin, I get all my medications. I take some pretty powerful anti-rejection drugs. I can't tell you how much this place means to me. It's a great organization that helps save my life.
In our first 20 years, we filled 1 million prescriptions for free. And so the question becomes, how do you fill your second million prescriptions? Because of the medication access program, we are able to do a month's worth of sorting in just one day.
St. Vincent de Paul Pharmacy is always going to be about patient care. There's always going to be a patient in need or a neighbor in crisis that doesn't have the medication they need to survive. We want to be the place where they can get that. We want to be the window that they walk up to and they never leave empty-handed. We want to be the place they go to get positive clinical outcomes, and we need help making sure that that happens.
After all these years, and thinking about going from 500 prescriptions to now over 1 million, I really want to thank everyone that's been involved with the program, both past and present.
You know, I think that some of the best things in the world are hard things to make happen. And I definitely put the Charitable Pharmacy in that category. But I think that if you follow where your faith leads you, you follow where your beliefs take you, you build your life around kindness for other people, you will find a way to make those things happen.
As we look ahead, the next 1 million prescriptions will take even more vision and leadership. Cincinnati has always risen to the moment, and now we're asking our community to lead us forward once again, so every person in every neighborhood can access the care they deserve. Together, we can write the next chapter of impact. The next 1 million starts now.